So hello, I'm Dr. Julie Platt and I've been here for 4.5 years.
I'm Dr. Antonio Villarivera Jr. I come from the Philippines. I'm currently an associate professor here in UMed, and I've been teaching for 7 years, mostly for years 3, 4, and 5. There's a variety of advantages to this. Number one, we all know that medicine is not only about treating patients but also doing research with modern management techniques, modern drugs, things that would eventually help them treat patients in the future.
Upon graduation, almost the world is their oyster. So they have 2 years of housemanship or foundation year training, and after that they can specialise in things like cardiology, surgery, obs and gynae, neurology, general practice, dermatology. The list is almost endless.
I think being a doctor is predicated on service. As you know, COVID has been ravaging the world for close to 2 years already. So I think there's definitely a need for more doctors. So more doctors equates to more patients being managed effectively. And more patients being managed effectively would eventually mean that more lives are saved.
So we meet with the supervisors who train our junior doctor or the NewMed graduates, and we want to hear back what they think of NewMed graduates. And the feedback has been consistent throughout the different hospitals and supervisors that we meet. And the feedback is that they have excellent communication skills, they're known to be dependable, hardworking and conscientious. We also meet with the NewMed graduates to find out how well they're performing in their hospitals, and I think what they seem to be grateful for NewMed providing are simulation skills and communication skills. It teaches them to interact well with their staff and patients.